The Optimal Health and Wellness Clinic at Morehouse School of Medicine is a clinic that focuses on prevention through lifestyle medicine techniques. When we say lifestyle medicine, we're talking about the way people eat, the way people exercise, the way people live their lives, how to reduce the risks that an individual can take control of in their lives in order to improve their health.
I view the Optimal Health and Wellness Clinic as the clinical arm of the preventive medicine program for our department. So traditionally, community health has not been involved in direct patient care. So when I see patients in the office and pick up a disease for them or identify their diagnosis, the first thing we recommend is lifestyle changes. And you know, in the traditional office visit, you don't have time to really go through what lifestyle changes are.
So the shared medical appointments are to me a very sort of gratifying way to see patients, because patients, you can educate 10 people at the same time, whereas if you see one patient, you're educating that person, and you don't even have enough time to educate that person.
So it is an opportunity for primary care physicians or any physician who has a patient with a disease that can be improved by lifestyle changes to have the opportunity to get into this clinic and actually see how lifestyle changes can be implemented and maintained for their overall health.
So the clinic is a new concept here for Morehouse. The average physician spends about 9 minutes with a patient on average, and really would like to do more education, would like to do more, but there just isn't enough time in the average visit. So our clinic was set up to educate patients, because that is really what makes a difference, having them change their behavior.
It's really important as we're really thinking about how we can holistically manage the health of our patients, understanding that if you just put the onus on the patient to make these oftentimes very substantial lifestyle behavior changes, you may not be the most successful, and that it really requires a village and a team approach to really make those changes happen over a long period, over a long term, and to really make them healthy habits. So I think for me, that's the biggest thing, is just understanding that we are a resource.
Patients should expect one-on-one, close and deep consultation with their physicians. They should expect that when they come out of this clinic, they'll have a great understanding of all the factors, all the points in their lives that can help them improve their health. They should expect not only that relationship with their physician, but they should also expect to be able to work in groups with other patients in order to improve their health, especially through the way they eat.
We understand how challenging it is to not only assess and get a sense of patients, emerging issues, challenges, but how challenging it is to also address lifestyle behavior changes, because that is really a process. And so making them understand or encouraging them to utilize us to help their patients walk through that process.
Well, again, this is a clinic that will be focusing on prevention. So thinking about people who have chronic diseases who are coming in, who are trying to get some management of their lifestyle, we think of that as tertiary care, trying to make sure whatever the diseases they have don't progress. But we're also going to be focusing on primary and secondary prevention, the things that prevent people who are healthy from becoming any worse, essentially, and also the techniques, the screening practices that we can put into place to ensure that if they have something going on a kind of a minimal level, they don't progress either. So we're going to be intensively looking at all of those techniques in order to keep our patients who are sick and the ones who are healthy as possible.